challenges. People may feel anxious, down, or overwhelmed. For some, these feelings can lead to changes in sleep patterns, an increased use of alcohol or drugs, or withdrawing from the people around them. If you know someone who's having a hard time coping, you can help by reaching out to talk and listen. To learn more about how you can help someone in need, call the Suicide Prevention Lifeline at 800-273-TALK. Brought to you by the state of Washington.
Do you know what to do if you think you might have COVID-19? Or what to do if you know you've been exposed? Here's how you can help protect your community. Stay home if you're not feeling well, even if you have mild symptoms. If you were in contact with someone who's sick, stay home while you watch for symptoms. Help may be available to get groceries and supplies. Get tested as soon as you can. Free testing may be available. Respond quickly when a contact tracer gets in touch. An interviewer will ask about people you've been in close contact with. You can follow these 3 steps to help find and stop the spread of infections. When everyone in your community does their part, businesses and schools can reopen safely. Find a testing location and learn more at coronavirus.wa.gov.
Rainier Avenue Radio.world is your 24/7 digital media hub. Tune in at Rainier Avenue Radio.world. Also find us on Facebook, Twitter, and TuneIn apps.
Welcome to Rainier Avenue Radio.world. It's me, your host, Tony B. This is our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. We have so many things going on surrounding the coronavirus because it impacts everything. Got a great lineup for you today. A number of different guests will be on. Joining us at 2:30 is going to be King County Health Officer, Dr. Jeffrey Duchin. We've heard about the CDC announcement now that essentially relaxed some of the masking guidelines, and this has all just been very confusing. As I mentioned last week, following the announcement that the CDC doesn't really have the ability to enforce anything. They can just simply make suggestions, and I wanted to make sure that was clear to our audience. The masking requirements are going to be something that ultimately local government, tribal government are going to make the decisions about. That's just the bottom line. What should we do in King County? How is King County going to be impacted and affected? The businesses, the individuals, and maybe even statewide. Jeffrey Duchin, King County Health Officer, will be here. And we're just going to take a look at this and try and get some answers as to how we should proceed before we get a lot of misinformation. And again, you're certainly allowed to question the science behind this. This has just been a revolving door of what we can do, what we can't do, what we should do, what we shouldn't do, as we navigate our way through this coronavirus pandemic. And again, we know that this has impacted so many different areas and exposed the systemic oppression and racism. Despite the fact that there have been a few politicians who've said that it's not there, it is embedded in our culture. And you're certainly free to disagree with me on that, but it is. So we'll be having these conversations coming up with you a little bit later. Also joining us will be John Dunn, Medical Director for Preventive Care, but also representing the Washington chapter of the American Academy of Pediatrics. Folks haven't been getting vaccinated for things that, well, there was no hesitancy to get vaccinated for, like the measles, the mumps, whooping cough. Numbers are down, and with school starting up again and summer camps, doing some hybrid situations and welcoming folks back, we're going to talk about that as well. One of our great partners since this pandemic begun has been the Urban League of Metropolitan Seattle. And you think what you will, but I appreciate the way that they have stepped up in a number of different areas on behalf of the Black community in particular, where leadership was sorely needed during this process. And so we've heard a lot more about the Urban League, the programs that they offer, the support that they provide. And so I'm happy to bring on to the program right now, Mr. Terrence Morgan. Terrence, how are you?
Hello, Tony. How are you? Thank you for having me on your show this afternoon.
Great to have you on. Well, we're going to be talking about the Career Bridge and the employment street fair that's going to be coming up. But for anyone who may be unfamiliar out there with who the Urban League of Metropolitan Seattle is, would you mind giving us a brief overview of the Urban League of Metropolitan Seattle, who they are, what y'all do, why you exist?
Yes, we're Urban League of Metropolitan Seattle. We are a nonprofit Black organization. We're the second oldest Black organization in the nation. We are here to empower and change lives in the communities, BIPOC communities. We help try to assist people with developing and also moving into a better way of life and into career-orientated employment. We also help with we got a housing, we have an education department, we have a workforce development department, we have civil engagement and departments. There's a number of things that we do in the community that it impacts the community in a positive way. We've been around this in Seattle. This is our 91st year as far as the Urban League being in existence. We're nationwide, and we're here to help growing the needs of those who serve by providing support services, programs, and opportunities through the 5 pillars of focus: education, housing, workforce development, health, civic engagement. Yeah, that's what we do.
All right, my man. And Terrence, give us a little bit of background information on you personally, professionally.
Okay. Well, as you know, I was raised here in Seattle, right here in the Central area. So I hold Central area close to my heart. I come from my mom's an immigrant from England. I've been formally in justice involved. I've been working with the community since 2011. After I was released from prison, I work with people that are in situations where you coming out of prison, domestic violence, homelessness. I've been doing this work with the Urban League it'll be 3 years in August. I've been doing this work. I came in as a participant navigator, just to assist people, and now I'm a program manager of the Career Bridge program, and that's about it.
That is tremendous. I don't know if you know, Terrence, but I believe it was Thursday that we had a statewide discussion about fair housing, particularly focused on folks who are coming out of prison and the struggles. Once that happens, in regards to when you put this information down on an application, and trying to be, straight up about it, the problems are so congratulations to you. And I know that you bring a unique perspective. And I know that was a little off the topic here, but yeah, I just want to say that. I don't know if you had a chance to listen to that particular show, but since you said that, I mean, just another example of, a punitive system, but not necessarily one that creates opportunities for people when they get out to be successful. You can disagree with that as well if you want to. I'm just putting that out there.
Mm-hmm. That's what's great about the Urban League, though, and the Career Bridge program. We don't turn nobody down.
All right. So, man, let's talk about the Career Bridge program. What is the Career Bridge program?
Okay, yeah, the Career Bridge program. Well, it's a job readiness program. This program was actually created in the prison by the Black Prisoners Caucus, and it was it navigated out into the community. And now we're in the community, and we serve the BIPOC community, the Black indigent people of color communities. We assist with trying to eliminate barriers for young adults between the age of 18 and 26. The Career Bridge program, the Career Bridge training curriculum focuses on soft skills developments, job readiness, health and wellness, basic computer skills, and building on students' individual strengths, and just try to prepare them for employment. The class consists of, first of all, it's virtual because of the pandemic right now. It's 2 days a week, Tuesdays or Thursdays between 1 and 2 via Zoom. It is an incentive program. The more outcomes you complete will incentivize you. But the great part about it is that we have an excellent job training program for the young adults. It's 3 weeks, 6 classes, 1-hour classes, and you get an incentive for that. Then we also connect you with a navigator, and you also be connected with a job developer. The navigator is there to help you with any barriers that are preventing you from being employed and staying employed. And also there are the job developer is there to help you develop your resume, cover letter, portfolio, or there to help you connect you directly with the employers. We've been doing this program, I think it's for 9 years now with the city of Seattle. We've also give up certifications. You can get certifications through the class. That's OSHA 10. You get a industrial first aid CPR and a flagger's card, free of charge. You get incentive for that, for taking that course too. We also have a trauma informed class, which will be on Wednesdays between 1 and 2, that help address individuals on how to identify and also how to coping mechanisms on how to get through trauma. We also offer the budgeting class to help with learning on how to budget your money, how to save, build your credit, how to save money, and be able to someday probably become a homeowner, or just learning how to know, what's frivolous spending and what's good spending, what's not good spending.
So, Terrence, who is eligible for the Career Bridge program? Is there an age requirement? Who's eligible? Who can take these courses?
Yes, you have to be between the ages of 18 and 26. If you're on a lease or you're the direct renter or owner of a home, you have to be within the Seattle city limits. If you're not on a lease, you are somewhere where they could say you have to leave, and you have to leave. That's considered homeless status. So we that would make you eligible for our program. Okay.
And are there any costs associated with this program?
No costs. Our program is designed to assist individuals with going into career-orientated professions, but also we know you have to walk before you crawl. So we know we have to be able to get them just the basic need jobs. We're there to help them with wraparound services. We'll help them with transportation, food if necessary, interview clothes. And then once they get employed, if they need tools, if they need like just work clothes or PPE, any kind of PPE, will help assist with those type of things there. Anything that can be a barrier, we're there to assist with the individual that is in our Career Bridge program.
My guest again is Terrence Morgan, Program Manager for the Career Bridge program. And this might seem redundant, Terrence, but I'm going to have you say this again, but I'm going to precede it by saying these services are provided for free 99, the commercial free. All this information is given, and these classes are provided for free. And in addition to that, you have other wraparound services to support folks. And I think this is critical information here as we're talking about this during the pandemic, because the pandemic did not give anybody any breaks. And if you were incarcerated or free release during this time, there was already unemployment had increased. We knew again that some of the safety nets had broken down. Again, you heard me talking about the show that we did on Wednesday, and one person was sharing how, you know, they were brought back to King County, and but they needed to get to Tacoma, and they were let go at King County and early in the morning, and given $40 and said, well, good luck.
Yeah.
And so again, I know this is a different conversation, but I'm just melding these two things together. So let's talk about this again. Who's eligible for the program? We'll start again, and I know you just described that. And then if you could once again talk about the services that you offer, what people will find within this program, because there may be folks out there right now going, this is exactly the type of help I need, or I know someone who could use this type of assistance, in particular during where we are at right now with the pandemic, with the economy, with the divisive political situation. So if you wouldn't mind, just kind of go over the age requirements, who you serve, and what you can provide.
Okay. Yeah. So the age requirement, again, that we go over is 18 to 26 years of age. We also were looking for individuals that are from BIPOC communities, which again is Black, Indigenous, people of color. We're looking to connect you with employers, and we're finding that as we're opening up, we have a lot of employers that are reaching out to us that are looking for employment. We're in partnership with Safeway. We're in partnership with Lowe's, with Home Depot. We're with FedEx. We have a lot of partnerships. We got with Columbia, Amazon. So we do have employers reaching out to us to send them people for employment. So if you are looking for employment, we can definitely assist you. If you're looking for a specific field, we have job developers that are trained to work with you to find you employment in that specific field. We also can, to some degree, we can help with training, or at least finding training for you. We're very connected with our community partners to where we'd like to do soft handoffs. If it's something that we can accommodate it with, we have community partners that we work with closely, that we would be able to hand it off to a community partner that could more than likely accommodate the issue at hand.
What would you say to someone? Well, let's start with this. How has the pandemic impacted the work that you are doing through the Career Bridge program? You mentioned that things moved virtually, but just if you can share with us how the pandemic has impacted the work that you do through the Career Bridge program.
Well, it's been a great impact on our program, for the simple fact that we for a great while there, everything was remotely, and we weren't able to be more hands-on with our participants. I mean, now that we're back in the office, we were able to be more hands-on. We're able to be more engaged with our participants. I know that for probably the first 6 to 8 months, it was hard finding employment for them because everything was shut down.
Yeah.
So that was a great impact on us. But I think, but moving forward to today, we have a lot of employers that are looking for employment. When we talk about the employment fair, well, we have a list. We have over 30 community partner agencies and employers that will be at this event.
Now, and obviously that's another thing that I want to talk about. And I just think this is really critical and important right now. And I want to give as much time as possible. So I'm not trying to break this on you, but because are you available if we don't get to everything that we need to come back and talk to us at 2:00? Because I get the feeling that we're gonna run out of time.
Sure, yeah,
okay.
Sure. If need be, yeah, I have no problem with that.
Okay, so I'm gonna stay with the Career Bridge program.
Okay, all right, let's do it
right now, and then at 1:30 we'll go ahead and we'll talk to John Dunn from the Washington chapter of the American Academy of Pediatrics, and we're going to talk about immunizations in general. But I just want to have some authentic conversation about this right now. From your personal experience, why is it? Well, I'm going to even take it back further. You said that this was something that started through the Black Prisoners Caucus.
Yes.
Why is a program like this specifically, working with folks who come out of incarceration? Why is this so important? Why is this a critical program of all the things that y'all do there? And they're all important, but people may not be aware of, again, some of the challenges that folks and that face, and that's why I'm talking a little bit about the fair housing thing and some of those barriers that are in place there. But from you, why is this program so important to people?
Well, in my opinion, and from my experience of being somebody that's been formerly justice involved, it's important to work with individuals coming out of prison, because myself, when I came out, I have been I have been incarcerated more than once. So, and it took me a few times to figure it out. But it all started with me having that support network there that can help me get to the next step of going to do what I know how to do. Because what I know how to do wasn't a good result for me. All right. So I know that Career Bridge is good because it helps you develop skills and also gives you a network to work with that's going to get you on the path of success. We've had since I've been working here, I've had numerous men and women coming out of incarceration that today are just flying. That's the only way I could put it. They're flying. They're working. They're either in a supervisor position or they're doing real good, like they work construction. Some of them are homeowners now, and I'm just talking. This is in a less than 3-year period. So, and I think it's important because, from my experience, DOC does not give you skills to come out here and stay out.
And for anyone out there who's listening right now and going, man, I've heard this before, but I'm really not feeling it, and there are a lot of reasons why folks, again, may feel that their place in society is unwelcomed, and they're thinking, okay, Career Bridge is This is just another. What would you say to someone right now who's listening but is having doubts about the sincerity of this program, the authenticity of your interest in making sure that people are connected and have an opportunity to be successful in our societies, in our communities?
Well, I would say that, first you have to go through the experience. And in my opinion, this is my opinion, that you'd have to go through the experience in order to say this experience doesn't work.
Okay.
This I've seen with my own eye. The curriculum for the job training program is excellent. Okay, facilitators excellent. And like I say, this is my opinion, and I know that we try to cover every possible scenario of assisting an individual to a path of success. And the way that we do it is by mainly we have people here that when you look across the table, this is somebody that's probably shared a similar or same experience that that individual is going through at that time.
Again, my guest is Terrence Morgan, Program Manager for Career Bridge. And I know that there's some things that you were prepared to talk about, Terrence, so I really appreciate you sharing your personal experiences.
Yes, thank you.
With our audience. I don't know that you anticipated that that's what you would be doing.
Hey, I got the call. Hey, we need you to talk about the program, and I hope that I really care about this program, because this program means a lot to me, because I know what it can do for people out in our community.
And so for folks who are looking for this opportunity, but say, well, okay, I'm in need now, and how long is this going to take? Explain to us about the curriculum, the classes. I think you said 3 weeks. How much time folks are looking at putting into this? What's going to be the end result, if you will? You mentioned that they may receive a certificate. Just kind of an overview, if you can, of the curriculum and the time requirements that one needs to think about vesting into this to be successful.
Right. So we have a curriculum, our Career Bridge Job Readiness Training curriculum. It's a 6-hour program right now. It's an hour on Tuesday, an hour on Wednesday via Zoom from 1 to 2. That is to help you, and that's for 3 weeks. So actually 6 classes, 6 hours, and we'll give you $150 stipend for doing that particular class. And it's just to help you develop soft skills, get you prepared for job readiness, to be prepared for what an employer expects, and what you should expect of an employer. We also work on health and wellness. Are you eating right? Are you sleeping right? Because these things are factors when you're in the employment world. The basic computer skills. We also have a basic computer skills piece that we like to engage people in really participating in. That's after the Career Bridge, we can get them into that. And then we just build, like I say, we just try to build on their strengths, have them identify their strengths and build on their strengths, identify their weaknesses, and work on making them strengths. That's what we try to do. And then after that, there's we have other outcomes, like you do that trauma-informed class, which I talked about earlier, about learning how to identify and address your trauma. We also have we call it relapse prevention class. It's on Tuesday evenings via Zoom. All these programs are via Zoom, and they're all part of the Career Bridge program. It's a relapse prevention class, and it's about when you hear relapse prevention, I know you think drugs, but it's really just a support group. And they talk about life skills. I mean, you're on there. I've been on there. I went on there several times, and some of the topics they had on there were just powerful. I was like, wow, And then you got just people that are coming from some of the same situations that we've been through, or they've been through, each other have been through, and they're sitting there talking, working it out together. And to me, that's powerful, and and at the end, like you say, you can come out with certifications, and you also, our goal is to have you coming out with a livable wage, a sustainable job, employment. I won't say job, because job is just over broke. So,
yeah. Okay. Man, again, Terrence, you'll come back at 2:00. We're going to talk about the employment street fair, but I just thought it was to take some time to really dig into this and your personal, I think added a whole lot to it. So we're going to go to break here. When we come back, we're going to talk about immunizations and a decreasing immunization rate. We're going to have a guest joining us from the Washington chapter of the American Academy of Pediatrics. And so if you'll jump back on here at about 1:57, 1:58, then we'll take from 2:00 to about 2:27, and we'll just talk about the street fair then. But I appreciate you obliging me and indulging me and letting me get in your Kool-Aid a little bit to share.
Yeah. Thank you for having me. And if real quick, I could say, if you are interested in signing up for the Career Bridge program, you can go to the Urban League, www.urbanleague.org/Career Bridge, and you can go there, or you can come to the Urban League on 105 14th Avenue, Suite 200, and just say you're here to sign up for the Career Bridge program. Okay. And you'll be back, and we'll give that information for folks who want to be in contact, who are looking for this opportunity again. Terrence, I'll see you in about 30 minutes. Sounds good. All right. Thank you.
We'll be back right after this.
This is Paul Pearson, host of Star Time. And when I'm not explaining to my intern exactly what R&B is, I'm listening to Rainier Avenue Radio.world.
This week's Rainier Avenue Radio Metro League Basketball Student Athlete of the Week award goes to O'Day Senior Jermaine Davis.
And on the other end, Jermaine Davis taking the pass over to Takeo. St. Sylvester back to Davis for the basket. And Tony, all at once, the Fighting Irish leading 52-46.
Behind Davis's 29 points, the O'Day Fighting Irish took control of their game against the Garfield Bulldogs in the third quarter and never looked back. Congratulations to O'Day Senior number 24, Jermaine Davis, this week's Rainier Avenue Radio Metro League Basketball Student Athlete of the Week.
My name is BK, International Talent Scout. I'm bringing a brand new show to you called BK Presents. 30 minutes, non-stop, your favorite in gospel music studio session. Going deep into interviews with your favorite artists, producers, and their engineers. You and your music. Concert previews and concert reviews. Get it all on bkpresents.com. Here we go.
We got the feeling now. Yeah.
R&B, soul, funk, 50s, 60s, 70s, 80s. We give you all that and more on Star Time. Join me, Paul Pearson, for a 2-hour trip through the history of R&B. A new episode every week on Wednesday at 2 p.m. Come and get the feeling on Star Time on Rainier Avenue Radio.world.
Keen Own honors and supports elders and families by offering culturally Asian and linguistically appropriate healthcare services in a healthy living community. Originally established in 1985 as the nation's first bilingual Chinese American nursing home, Keen Own now provides a full continuum of care, including wellness and education programs, home care, assisted living apartments, rehabilitative services, and long-term care. For more information, please visit keenon.org. That's KINON.org. This has been a public service announcement from Rainier Avenue Radio.world.
Rainier Avenue Radio, your community radio station will provide you with more information. Rainier Avenue Radio.
Welcome to Rainier Avenue Radio.world. And for some of you, welcome back. We just finished talking with Terrence Morgan, Program Manager of Career Bridge for the Urban League of Metropolitan Seattle. And if you are looking for employment, in particular during this pandemic where businesses were shut down, unemployment is through the roof. And if you add on that, you're coming out of incarceration, then this all could have just been very overwhelming. So go back and check out that show about the Career Bridge program and what the Urban League of Metropolitan Seattle is doing to assist you and connect you with employers who are looking to hire you, so that when you put previously incarcerated down, because they're going to check that it's all above board, and folks are aware that everybody deserves a second opportunity. So check that out. You are listening to our special program that we do from 1 o'clock to 3 o'clock every Friday on the impacts of the coronavirus on South Seattle and surrounding communities. We started doing this program in 2020 on March 13th. And when we got to summertime, July and June, and things had been exacerbated by I'll just call it a social reckoning following the George Floyd murder. It only became more clear that we were not all in this together, and that the pandemic had certainly exacerbated what were already some existing inequities and injustices within our system, and brought up this conversation of systemic oppression embedded in our systems. Healthcare, of course, was one of those systems. So right now we're going to be talking about immunizations and the impact of the coronavirus on immunizations. But we're going to do a little review, and I'd like to bring on my special guest right now, the medical director for Preventive Care, John Dunn. John, how are you? I think you're on mute, John. John, we still can't hear you. Can you hear? Let's start with that. I think you can hear me, but I think that you are muted. Not getting any sound from you. Can you hear me? If you can nod your head yes or no, if you can hear me. Oh, okay. And occasionally this does happen with technology. And so let me ask one more again. John, can you hear me? We can see you. And if you can just nod yes if you can hear me, or no if you wouldn't do anything if you can't hear me. So that's I'm taking it that at this point you are unable to hear me. We cannot hear you. And let's see if we can get this rectified. You're listening to Rainier Avenue Radio World. It's me, Tony B. My guest is again John Dunn. Aside from being the medical director for Preventive Care, John is also going to be representing the Washington chapter of the American Academy of Pediatrics. And John, can you hear me now? Okay. We're going to try and figure out what's going on here. So I'll tell you what, Mr. Producer, let's take a quick commercial break again and see. John, can you hear me?
Let's see.
Oh, I think there we are right there, John. John, are you there? I thought we had something for a moment. Okay. The hello, John. I don't think you can hear me, but I think that I hear your microphone. Yes, we can definitely hear you now. We'll work this out. Yes, John, we can definitely hear you. While we're I think I'm going to hang on right here because we're apparently really close, and I can see that John is trying to resolve the situation. And oh boy, we'll get this figured out. I'm a little hesitant to go to break because it seems like there's a pretty easy solution to what's going on right now. I'll tell you what, Mr. Bellis, let's go ahead and see if we can. Let's go to break and see if we can get this figured out.
This is Paul Pearson, host of Star Time. And when I'm not explaining to my intern exactly what R&B is, I'm listening to Rainier Avenue Radio.world.
This week's Rainier Avenue Radio Metro League Basketball Student Athlete of the Week award goes to O'Day Senior Jermaine Davis.
And on the other end, Jermaine Davis taking it. The pass over to Takeo. St. Sylvester back to Davis for the basket. And Tony, all at once, the Fighting Irish leading 52-46.
Behind Davis's 29 points, the O'Day Fighting Irish took control of their game against the Garfield Bulldogs in the third quarter and never looked back. Congratulations to O'Day Senior number 24, Jermaine Davis, this week's Rainier Avenue Radio Metro League Basketball Student Athlete of the Week.
My name is BK, International Talent Scout. I'm bringing a brand new show to you called BK Presents. 30 minutes, non-stop, your favorite in gospel music studio sessions. Going deep into interviews with your favorite artists, producers, and their engineers. You and your music. Concert previews and concert reviews. Get it all on bkpresents.com. Here we go.
We got the feeling now.
R&B, soul, funk, 50s, 60s, 70s, 80s. We give you all that and more on Star Time. Join me, Paul Pearson, for a 2-hour trip through the history of R&B. A new episode every week on Wednesday at 2 p.m. Come and get the feeling on Star Time on Rainier Avenue Radio.world.
Keen Own honors and supports elders and families by offering culturally Asian and linguistically appropriate healthcare services in a healthy living community. Originally established in 1985 as the nation's first bilingual Chinese American nursing home, Keen Own now provides a full continuum of care, including wellness and education programs, home care, assisted living apartments, rehabilitative services, and long-term care. For more information, please visit keenon.org. That's KINON.org. This has been a public service announcement from Rainier Avenue Radio.world.
Rainier Avenue Radio. Your community radio station will provide you with more information. Rainier Avenue Radio.
Welcome back. All right. Welcome back to Rainier Avenue Radio. It's me, Tony B, and I think that we got these things worked out. So I'm going to see if we bring John back on again. We've got a backup plan here, but let's see if we can bring John back and see if the headphone situation and the virtual are still working. So let's try and bring John back on that way and bring him into the broadcast room. Okay, John, are you?
Greetings. Can I actually be heard now?
John, we can hear you now. Can you?
Fantastic. And I can hear you. I'm so sorry about that.
All right. Well, welcome to the program, John, and thank you for joining us. And again, I know it was a kind of a short notice for you, but I appreciate you coming on and addressing some things that, again, as we are transitioning, if this is what you can want to call it, a transition from some of the things that we've been experiencing during the pandemic in regards to isolation and the science and what we should be doing and shouldn't be doing and the repercussions of this. We're going to talk about immunizations, but before we do that, I want to get some information from you to get some background for folks who are tuning in and listening and may not know much about what's going on here. The Washington chapter of the American Academy of Pediatrics. Just exactly what does that mean, and what does this particular organization do?
Sure. What we are is our state's chapter of a large national organization. The American Academy of Pediatrics is a very large organization, very old. That's essentially an association of pediatricians and pediatric practitioners from all over the United States. Our missions are fairly broad, but in general, it is to promote the best possible health and well-being for pediatric patients, which really means children up through the age of 18. The national organization. The national organization helps to disseminate information, set policy, and generally works to further these goals. Because really all of healthcare, when you get right down to it, takes place where the rubber meets the road, and that is really at the individual level. What works out very effectively is for every state to have a local chapter for the organization, and the Washington chapter AAP is really our local chapter for that. That chapter, in turn, has several different committees and work groups, and I lead up our vaccine committee, and that's a committee of probably 20 of us who have a particular interest in immunizations and doing what we can to help further these in the community, to help practitioners be able to provide these as effectively and efficiently as they can, and to make sure that the people that we serve, that is the members of our community, have a resource that they can go to have questions answered.
And you kind of addressed this a little bit, but if you give us further information about you personally and your role as medical director for preventive care.
Sure. As I said, I'm one of the members of the Washington chapter for the American Academy of Pediatrics, and that means that at base I'm a pediatrician. I've been in practice for I think 24 years now, since I got out of residency. That is still part of my job. I work for Kaiser Permanente up in the Seattle area here. A large part of my job with Kaiser Permanente is actually acting as medical director for our preventive care programs. And those are programs across a broad spectrum that really have to do with virtually anything that involves clinical prevention. So I work with adults on breast cancer, cervical cancer, colorectal cancer prevention. We work on well visits for both adults and children. And among the many things that I do is run our immunization program at Kaiser Permanente, Washington.
So, immunizations, would that be considered part of preventive care?
It would, and the reason we consider vaccines and immunizations to be part of prevention is that they're different than a lot of other things in medicine. Much of medicine has to do with treatment, where someone comes in, they have a particular problem, and we either treat it in the office, for example, if it's a broken bone, or provide a medication to treat it if it's a pneumonia, or provide advice on how to best take care of it, which actually is probably what we do more than anything else. Preventive care is the sort of care that we do to try to keep problems from happening in the first place. So when I talk, for example, about breast cancer prevention, my primary focus is on people who don't have it yet. I want to make sure that they get screened, which means tested in advance, so that if they're starting to develop it, we can catch it early and do something about it. Vaccines, which are immunizations, are really an extension of preventive care, because when we give someone a vaccine, we're not giving it to them like a medication to help treat a disease that we've got. We give them vaccines in hope that we can protect them from ever catching that disease at all. And by extension, from if they do catch it, from passing it on to anybody.
And, you know, John, there was an increased awareness, again, because of the search for a vaccine for COVID-19. And the conversations around immunizations kind of took on a life of their own. Immunizations did not begin with COVID-19. And so before we dive into this a little bit more, let's talk about vaccines, if you wouldn't mind, historically, the role that vaccines have played. And again, just the fact that immunizations did not begin, vaccines did not begin with COVID-19. And there are a lot of things that we don't even think about anymore, don't worry about anymore, because there have been vaccines.
That is absolutely right, and that's one of the things that has sometimes made it challenging to discuss immunizations, particularly with people who are fairly young and didn't grow up in a world where certain diseases existed. We vaccinate everybody, for example, for all children for a condition called polio, and I will bet my lunch money that not one person listening to the radio right now who is under the age of 70 has ever even met anyone who had polio or seen anyone who had polio, or if they have, it's been one single thing. But at one time, for example, when my parents were children, this was a disease that came in outbreaks frequently. It caused paralysis. And when parents would hear that there was an outbreak going around, they would go drive, get their kids at summer camp, bring them all home. They'd take them out of school and hide them in their homes so that they wouldn't catch it. Because like many of the diseases that we vaccinate for, it's something that was not only not preventable, but if you caught it, it wasn't treatable. There's a laundry list of diseases like that, and not all of them are ancient history. When I started in medical school, there was a condition called Haemophilus type B that used to give young children a condition called meningitis, which is an infection in the brain and spinal cord. And it could kill a child in about 24 hours. And about a year or two after I went to medical school, there was a vaccine that was introduced for it. And by the time I got out of my medical training, this was literally no longer a consideration. We see maybe 5 cases a year in all of the United States. I personally have not seen any case of Haemophilus type B in over a quarter of a century. And that to me, remembering what it was like beforehand, is nothing short of a miracle. anyway, it's that same principle of trying to prevent diseases, not just mild diseases, but diseases that can spread easily in a community and that, at least in some people, can cause serious harm or death. That's really the thing that drives work around vaccination, and that's the reason that I and other healthcare providers are always so passionate when talking to people about these.
My guest again is John Dunn, Medical Director for Preventive Care with Kaiser, also representing the Washington chapter of the American Academy of Pediatrics. John, how has the pandemic impacted the work that you do? And I'm not trying to drag you into the political football conversation of this, but it's almost impossible at this point, to have this. Has the coronavirus impacted the work that you do? And if so, how?
Oh, in almost every imaginable way. The greatest impact, I think about my role as an advocate for vaccines with the Washington chapter of the American Academy of Pediatrics, or as the head of the vaccine program at Kaiser Permanente. The greatest way in which coronavirus has impacted my role is that all of a sudden it's become tougher than ever before to make sure that both kids and adults are actually getting into the office to get the vaccinations that we need to make sure that they get in order to protect themselves. The sad thing about all these diseases that we vaccinate for is that while some of them are almost vanished, they're not quite there. They still occur occasionally, and some, like pertussis, which is whooping cough, there will still be thousands of cases of that every single year, and periodically people will die from it. The way that we keep those diseases in check and make sure that we don't have enormous outbreaks involving hundreds of thousands of people, for example, is by making sure that everybody is adequately protected by being vaccinated. Unfortunately, when the outbreak first happened, as you and everyone else will recall, we really emphasized to people, everybody stay home, protect yourself. We want to make sure not to overburden clinics. We want to make sure that you're not coming in for anything that's not really important. And unfortunately, we made that sales pitch so well that I think that inadvertently we neglected to really communicate to people that making sure that their children are vaccinated on time, and for adults, making sure that they get vaccinated for certain diseases on time, was actually one of the important things that we still wanted people to come in for. But for a period of months last year, I won't say nobody came in, but far fewer people came into medical offices than would typically be the case. And our rates of vaccination dropped enormously. We gave only a fraction of the vaccines that we normally give. For children in particular, preschool children who are young and are particularly vulnerable to many of these diseases, that means that many of them right now have been left totally unprotected. And when we have a large population of kids that are not well protected from diseases like measles or like tetanus or pertussis, then periodically what we have happen are outbreaks. All of you will remember the measles outbreak from a few years ago. And again, the reason that we want to make sure that we can prevent these diseases is because many of them, like measles, like mumps, we can't effectively treat them. And while most people who get a disease like that, they might be fairly sick for a while, but then they'll get better. Occasionally, there are long-term problems with things like a measles infection. A small number of people can die from a measles infection. And we can't necessarily do anything about that. And that's why it's so important to us to make sure that we protect everybody as well as possible beforehand. Right now, what we're trying to do is make sure that everyone who missed their opportunities to be immunized during the last year, during lockdown, the thing we want to tell them is we're wide open. all medical offices are open again. We are seeing people on regular schedules again. We want people to come in for well checks. We especially want them to come in for immunizations. And of course, if they're 12 and older, that includes immunization against COVID.
All right, my guest again, John Dunn, representing the Washington chapter of American Academy of Pediatrics. John, we got started a little late, so we're almost out of time. I appreciate you coming on Rainier Avenue Radio. If you don't know, now you know. What we do is we have open, honest, and frank conversation for our communities. And since we're all almost out of time, let's just get to the down and dirty of this. We've seen disparities in COVID infection rates across race and ethnicity, with BIPOC communities hardest hit. And similarly, we've seen gaps in COVID vaccination rates between white communities and BIPOC communities, particularly Black, African American, and Latinx communities. When it comes to routine child vaccines, do you think similar disparities exist?
Unfortunately, I know for a fact that similar disparities exist. This has been a particular challenge, and there's a laundry list of reasons for it. These reasons range. Sometimes they have to do with the ability to access care or to be able to easily get in to get these things done. Some of it, to be perfectly frank, has to do with some level of mistrust. There are many people in these communities who frankly, quite understandably, view some of these initiatives with a little bit of suspicion, and I certainly don't blame them for that. I can understand that, and I can't say that I would necessarily feel any differently. I would encourage all your listeners of any ethnic or racial background to understand that we do recognize that, and unfortunately rectifying the problems that have caused this to be the situation we're in is going to be an ongoing thing. I think I can give commitment that I understand that challenge, and that I would always be happy if people have questions, if people have concerns. They are always welcome to approach me or anyone else to ask about that. I want to make sure with anything like immunizations that we proceed in what we're doing with partners. But the recommendation that I make, which is absolutely get the vaccine for COVID and absolutely get all the other ones that are recommended, I make categorically across the board. And as I often tell our staff here when I ask them to do something, I would never ask any patient or any colleague to do something that I would not be personally willing to do myself. I feel bad that we started late, because this is a topic that I'd love to talk more about, and I'd be happy to come back at some time and we can talk further.
Okay, we'll make that again, John. I think this is critically important as well, and this may seem unrelated to you, but obviously you understand some of the reasoning behind the hesitancy in some of the communities, and then on top of that, now we're introducing this thing called a vaccine for 12 to 15-year-olds into the mix. And as you are fully well aware of, and Jeffrey Duchin will be here at 2:30 to discuss as well, the CDC changed some guidelines about unmasking and what folks could do. And again, I remind everyone that it is your local government, your tribal government, that will actually make these decisions. The CDC, they don't have a law enforcement component with them. They're just suggestions. But with that thought in mind, because I heard you advocate for it, what would you say? And I'm going to give you the chance for final words after this, so it could be, even though we got started late. But what would you say now, again, about the hesitancy and what, for whatever reason, we're seeing a decline in immunizations that folks were getting? But what would you say to folks about the trust level in this vaccine for 12 to 15-year-olds, and why it is, or maybe isn't, important to make sure that your 12 to 15-year-old gets this COVID vaccine?
That I think is an excellent question. It's the reason that it's important from a community standard. Obviously, it's important that we get as many people as possible vaccinated, and it's also really important from a personal standpoint. It's what we do know about younger children, about adolescents, is that yes, compared to say a 70-year-old, a 14-year-old is somewhat less likely to have a severe bout of COVID disease if they actually catch this virus. However, that doesn't mean that everybody has a mild course. There are young children who do catch COVID and they do get terribly sick. A small percentage of them will die, or they will have symptoms that continue to last and linger long after the disease itself is resolved. And there's no good way for us to know who that's going to be. The way I thought of it, even for myself, was that I figured I was unlikely to have a severe course of this disease, but that's not a chance I wanted to take. And from a safety standpoint, the vaccines actually have been fairly well looked at. So I had the opportunity to actually look at the research data that went into all this, and I at least personally can say that I felt confident that it was safe for myself to use. And frankly, I have a niece that falls into this age range, and my brother asked me exactly this question, and we talked about it for a while, and I told him and her that I thought it was safe for her to use. As I said, I wouldn't ask anyone to do something that I wouldn't be willing to do for myself or for my own flesh and blood. The other thing for people to consider is that even if you catch the disease and you don't get symptoms at all, you can pass it on. And the people you pass it on to might not be so lucky as you. When you think about your loved ones, when you think about others in your family or in your community, in particular, in some of these communities, among BIPOC, there are certain groups of people who are at higher likelihood to have a severe course if they catch this disease. Those are precisely the people that I think it's most important for us to ensure that they don't get it themselves, and that, God forbid, they don't pass it on to somebody else who's really going to be at high risk from having a problem with the disease. All of this work is being driven from a larger public health standpoint, but I always encourage people to think about it locally. Think about it for yourself. Think about it for your family. Think about who you can protect that you know, and why it is important to protect them. This is the best single thing we've got to help you accomplish that.
All right, you're listening to Rainier Avenue Radio World. It's me, Tony V. This is our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. We are a little bit off schedule today. John, I appreciate you coming on short notice. Again, I just think this was a critical time to have the conversation, and that doesn't always lend itself to availability. And in a crisis, with Rainier Avenue Radio, we think it's extremely important that information may be shared through other mediums is given to us, so we can get it straight, from the resource rather than from other media that is not always trusted as well. I'm going to give you an opportunity, for final words here. We've been talking about immunizations and vaccines, and again, a declining rate of immunizations and gaps in immunizations between Black communities, Latinx communities, and of course you just verified that yes, these do exist, which was one of my questions, because I had asked, again, it's what we think, but I was saying, okay, do we have any evidence-based research that we can validate this with. So I want to give you a chance for final words here, and then we're going to bring on Terrence. We're going to go to break, and then we're going to bring Terrence Morgan from the Urban League of Metropolitan Seattle back, and we're going to talk about the employment street fair. Again, we just, we got started late, and this may have been confusing. So I want to give you the opportunity here, John, for final words before we.
I think that you've summed it up well. Again, my great encouragement to everybody: you talk to people you know, talk to people you trust. I frankly appreciate the opportunity to talk with everybody today. I think indeed that I can come on and I can give you reasons, I can give explanations, but I think that it's important that you feel confident in what you're doing here, and I do want everyone who's listening to be aware that in all communities we are in fact seeing large numbers of people getting vaccinated, and that's hugely encouraging to me. The thing that I think is most encouraging, frankly, is that these conversations are taking place. I think the fact that we recognize that this is a challenge, and that there are a lot of different considerations that go into somebody's decision whether to vaccinate or not vaccinate. I think that the more that we get that out in the open, and the more that everybody feels comfortable, confident, and honest when talking about it, the farther we're going to get with that. Again, my final encouragement is: remember, this is something that you need to do for your community and for yourself and for your family. And I want you to think of it most in those terms.
Thanks, John, for joining me.
Thank you very much. I apologize again for the delay at the beginning.
Hey, it happens, man. That's another one of the things that we've been dealing with is the technology working, and sometimes, as it is wont to do, not working, and I can tell you it happens. So, but I'm glad that we got to do this. Again, we're a little off schedule here. I'm going to be talking to Terrence Morgan. We're going to be talking about the Employment Street Fair put on by the Urban League of Metropolitan Seattle. We'll be back, and we'll bring Terrence on. And then later on, we'll have Jeffrey Duchin, the King County Health Officer. And we're going to see if we can make some sense out of this mask, unmask, CDC guidelines, what's going to be happening in Washington, who's safe, who's not safe, how business is going to do with this. And then, there's still the political effect behind this as well that you have to factor in. We'll be back right after this.
Here with the Rainier Avenue Radio Traffic Update. You can listen to us in your car 24/7 anytime by downloading the free TuneIn app. Once you do, search Rainier Avenue Radio. And remember, do not curse out your fellow drivers. This has been your Rainier Avenue Radio Traffic Update.
This week's Rainier Avenue Radio Metro League Baseball Student Athlete of the Week award goes to Franklin Quaker pitcher Carson Burke.
Burke winds, pitch, swing, and a miss, and that will retire Brendan for Rainier Beach. So 1-2-3 for Franklin pitcher Carson Burke.
Carson Burke pitched a shutout, not allowing a single run in a dominating performance against the Rainier Beach Vikings. Congratulations to Carson Burke of the Franklin Quakers, this week's Rainier Avenue Radio Metro League Baseball Student Athlete of the Week.
This is Big Poppy, host of Jazz from the Cabinets. Join me each week for a listening tour of the first century of jazz, an eclectic mix of Dixieland, big band, cool jazz, bebop, contemporary jazz, world jazz, all jazz in all forms. That's Jazz from the Cabinets with Big Poppy on Rainier Avenue Radio, streaming worldwide on RainierAvenueRadio.world.
Phil-Am Radio, servicing the Filipino and Filipino Americans all over the world. Phil-Am Radio, streaming live in the internet every Tuesday from 1 o'clock to 2:30 p.m. Seattle, USA time. We are your host, Kuya Bert Kawili, Emma Heron, and
Manny Panganiban.
Radio.
Atlantic Street Center has been serving the children, youth, and families of the Seattle-King County area since 1910. We partner with families and communities to raise healthy, successful children and youth through services including counseling, early learning, youth development, domestic violence, and education support for school-aged children. Committed to serving the African-American community, Atlantic Street Center provides services and support for all marginalized people. Learn more at AtlanticStreetCenter.org.
This is Rainier Avenue Radio.world.
Welcome back to Rainier Avenue Radio.world. It's me, Tony B, and joining me once again is Mr. Terrence Morgan, Program Manager for Career Bridge. And we're going to give you some information about, let's bring Terrence on. How you doing, my man? Welcome back.
Hey, how you doing there again, Tony? Two times in one day. That's pretty good.
We're going to give you some more information about getting in contact with the Urban League for Career Bridge. But we're going to be talking about the Employment Street Fair that's going to be taking place next week. Before we delve into that, Terrence, for anyone, again, who's interested in the Career Bridge program, how can they get in touch with you? How can they get on if they want to be involved and engaged and participate?
Yeah, to connect with us here at the Urban League, you can go to www.urbanleague.org//career bridge, and it will direct you right to our page. It will give you all the information about our program and also how to sign up. Or you could come to the Urban League on 14th and Yester, 105 14th Avenue, Suite 200, Monday through Friday between 9 o'clock in the morning a.m. and 5 p.m. Just when you come, just ask the receptionist, can you sign up for Career Bridge? You will fill out some intake packet, and then you will connect with a participant navigator that will sit down and talk with you. Just get to know you, and you get to know the navigator, and we kind of get a feel for what you want to do. Then you possibly can meet with a job developer right there, and we could possibly look into getting you into employment before you even start the JRT class. We recommend that everybody do the JRT class, but at the same time, we will try to find you employment immediately. But that's how you connect.
All right. And just in case we caught everybody off guard, or anybody off guard, or anyone off guard, Terrence, I'm going to ask you to share that entire piece of information one more again, so that folks, and right now I'm giving folks an opportunity to say, well, if you need to get a pen or a pencil, this is a stalling tactic.
Oh, yeah, there you go.
So that you can begin to write this down. Okay, so Terrence, one more again, please, for folks who want to get out, for folks who want to be involved, for folks who are interested in finding out more information about engaging with the Career Bridge program and the Urban League of Metropolitan Seattle, what should they do?
Yeah, thank you, Tony, for letting me share it again, because I did forget a piece. The Career Bridge program is for young adults between the age of 18 to 26. And if you're interested in the Career Bridge program, it's a job readiness training program where we'll assist you with finding employment. We'll assist you with your barriers of keeping employment, finding employment and keeping employment. It is an incentive program, so you will get incentives for outcomes that you complete, like our job readiness training program. It's 6 classes, 1-hour classes via Zoom on Tuesdays and Thursdays for 3 weeks, and we'll give you $150 for completing that. But we will also connect you with navigators and job developers to help you with getting your resume, cover letter together, and helping you with the barriers that are preventing you from being employed. But if you're interested, you can contact us at www.urbanleague.org/careerbridge, and then go ahead and take you directly to our page, and you can put in an interest form there, and then someone will reach out to you, or you can come to the Urban League at 105 14th Avenue, Suite 200, Monday through Friday, between the hours of 9 a.m. and 5 p.m.
All right, my man. Thank you, Terrence. Employment Street Fair. Man, that's something we haven't heard in over a year.
I know. It's we're all excited around here for having this opportunity to do this. I really want to thank our upper management for allowing us to do this. I think it's needed because it will be still a COVID protocol. You'll have to wear a mask. We'll have to social distance still, but it's something that our team talked about, and we were like, hey, this might be good. It's to give us an opportunity to connect with the community and our community partners to connect with the community. And we have a large lineup of community service providers and employers coming. It's going to be from 11 a.m. to 3 p.m. on the 26th of this month, which is next Wednesday. At 1301 East Yesler, which is in the parking lot of Bailey Gassert Elementary School. And I would like to say thank you to the principal, Mr. Ronnie Bell, for allowing us to occupy that space for this. We're going to have job resources. Some of the employers will be doing on-the-spot interviewing, so they will be hiring on the spot. And we have places like Amazon, Goodwill, Evergreen Salad. We got FedEx will be there. The Space Needle will be there. Restaurant Depot. Then we also have community service providers like Anodyne. Mary's Place will be there. Let's see who else. We'll have our housing department will be there. Streets to Homes Plus and Career Bridge. Our construction trades program will be there. Our Infotech program. We'll have the King County Public Health and Access and Outreach will be there. We'll have our education department for our younger individuals to be able to get involved in and sign up for some of their programs. We'll also we'll have Molina Healthcare and Access Wireless there, and they will be giving out. They will be talking to you about insurance, and they'll be giving out free cell phones for those that are in need of cell phones. But there's you do have to have your ID, and you do have to have proof of insurance.
Wow. It's just been so long since we've been able, and what we're talking about here, Terrence, correct me if I'm wrong, you get to physically be there. Again, social distancing, yes. But we're talking about this isn't over Zoom, you know. Am I right? You get to physically show up and talk.
Yeah, you get to physically show up, and requirements for participating in this event. It's no cost, but you do have to register at the front of the parking lot or the rear of the parking lot, because we have to take your temperature, and we have to we want to know who's there just for protocol.
And we're talking again about the Employment Street Fair. I don't know if this is one of the maybe the first since the rules have been relaxed a little bit. Later on, I'm going to have you again mention some of those employers that'll be there. But John, you forgot one.
I forgot one?
Yeah. Rainier Avenue Radio is going to be there broadcasting.
Oh, that's right. Yeah. Hey, for sure. Rainier Avenue Radio will be present and accounted for at the Employment Street Fair on 5/26/21.
And we'll be there broadcasting live from 11 to noon for folks who can't make it for whatever reason. And again, everyone, isn't able to take advantage of this opportunity. And I'll just put a little plug in out there. We are looking for producers and engineers, and maybe you have an interest in being an on-air person. See, I'm shameless plug for ourselves. And certainly we are a community-driven organization. And so that's where we get our volunteers. That's where we get our interns. That's where we get our staff. And so we're excited to be there, not only to broadcast live and have conversations with some of the employers, but, maybe you want to consider a career in media broadcast too. Mm-hmm. So yeah, that's my plug. Terrence, share with us a little bit about putting this together and making the decision during these times about, let's just go ahead and make this physically happen. We've been through a long period of isolation, and among other things, for a lot of people, it was just a disaster on their mental health because people like to connect, people like to communicate. What were some of the thoughts about saying, we're going to make this happen?
Well, it all pretty much started. Upper management came to the team and was like, we all need to put our minds together and come up with a way where we could be seen in the community. And so we put our minds together, and it was like, hey, how about an employment street fair? This would be something where we can bring not only the community together, but we could bring our community partners and some of the employers that we have relationships with together. And because as we slowly start opening up, employers are looking for employees, and we are a workforce development program. So we were thinking, let's do something where both the community and those that serve the community can benefit from. And also to just kind of break that monotony of isolation.
And again, I just think this is awesome that this is taking place. It's going to be next week, May 26th. The event itself will be from 11 to 3. And my understanding, Terrence, is there may be opportunities to get interviewed. Correct me if I'm wrong here, right on the spot.
Yes, there may be opportunity. We will have employers that will be doing on the spot interviews, and there's some that will be hiring right on the spot.
Wow. Again, the Employment Street Fair, May 26th. What's that address? Again, I think it's Bailey Gatzert. Bailey Gatzert I think it's a K-5 school.
Yeah.
But in the parking lot there.
Yeah,
13 playground. Is that right?
Yeah. Right. Yeah. It'll be in the parking lot. It'll be in the east parking lot, and it's 1301 East Yesler. There is no parking provided, so you'll have to find parking on the street. We're looking into parking at Washington Hall, which is a block away. So, but we just ask that you come. Let's get together as a community in a safe way, and let's try to help individuals that are in need of employment or in need of services. We will have our housing department there, and they can be there to answer any questions about housing. We'll have our civil engagement team there. They'll be able to help answer any questions about laws, legislation, and laws that are being passed or signed into law. They're a great team. And then we have fantastic community partners that are there, and it's an array of everything from being homeless to finding employment. And we're just there to serve the community, and we will also be serving food. We'll have a food truck there too as well.
And I want to give you the opportunity for final words here, Terrence, about the Employment Street Fair, and then also again name off some of the employers that will be there.
Okay. Well, I would like to say, we would like to see all of you come out, or those that are listening, just to support and also be able, if you're in need or if you know someone that can benefit from this event, please pass the information on. You can go on www.urbanleague.org and you can find out all the information about it. You can actually register to come to the event, but we just ask that you come out. I know a lot of people are real skeptical about coming out and communicating with people, but we are practicing. You have to wear a mask. and you have to be checked before you could come into the street fair area. I would say we got some of the employers coming out. We got, again, I'll say we got Goodwill, Amazon, Evergreen Salad, Whale, Space Needle, Restaurant Depot, Columbia, let's see who else, FedEx, King County Public Health and Access will be there. We got Integrated Wellness Care Management Solutions, they'll be there. Uplift Northwest, Deploy HR Incorporated, I don't know if I said Mary's Place, Anodyne, they'll be there. They're a great organization too. And then we'll have Molina Healthcare and Access Wireless be there to talk about insurance and give out free phones. And Rainier Avenue Radio. I was waiting for you that time, Tony.
Hey, and if you're just tuning in right now, go back and you can listen to a wonderful conversation Terrence and I were having about the Career Bridge program as well. That you'll be able to go back on YouTube and Facebook and then on our website and take a listen and take a watch to that as well. Terrence, thanks for coming back, man.
Yeah, thank you very much for having me, Tony. It's been a great pleasure, and I look forward to seeing you on Wednesday.
All right. Coming up next, we're going to be joined by Jeffrey Duchin, and you heard a little bit, even in this conversation, about the hesitancy that some folks have about saying, okay, these new CDC guidelines, how safe is this really going to be? Well, our King County Health Officer, Jeffrey Duchin, will be here. And, Jeffrey comes on and he just gives a straight talk about things. So we're going to find out and try and assuage some of the, if you have some hesitancy, we're going to try and get you some answers so that you can be comfortable in whatever decision that you choose to make with all the information that's coming out now about unmasking. We'll be back with Jeffrey Duchin right after this.
This is Paul Pearson, host of Star Time. And when I'm not stopping a Mercer Island street brawl, I'm listening to Rainier Avenue Radio.world.
It's May, and we will be celebrating Asian American Pacific Islander Heritage Month all month long here at Rainier Avenue Radio.world. Stay tuned to the special programs highlighting, celebrating, and honoring the contributions of Asian Americans and Pacific Islanders. Please check us out at www.RainierAvenueRadio.world.
Rainier Avenue Radio, your community radio station.
This is Cindy Bray, the host of Heartbeat Radio.
This is Paul Pearson, host of Star Time.
This is Paul Schneiderman today on the 73rd edition.
Hey, y'all, welcome to Travelers Guides with Venus and Mars and Princess Robin.
Godmothers.
Yes, no, we
Dirty Harry. Your home for information about the impact of the
coronavirus. Amongst many things that difficult about this virus is that it prevents
it's been devastating. They're really heartbreaking stories of people who have.
There isn't anyone that isn't impacted.
Shutting our schools down, including all athletic programs.
Your first-hand accounts.
We got here to test, and I found out that I work from.
A lot of people who know me, I'm still the first person they know.
But it was almost like you were patient zero for South Seattle. Your stories of community coming together.
Partner very heavily with Tacoma Urban League, who is doing some amazing work in response.
We're doing things for small businesses. We're giving out loans to small businesses.
And so I think it's very important that we have leaders who feel.
I cannot tell you, we're calling 20, 30, 40 minutes.
This crisis in our community, we've been working to address it.
Rainier Avenue Radio, broadcasting 24 hours a day, 7 days a week.
DJ Dirty John.
Terrence with Rainier Avenue Radio.world.
Search it for cool. Rainier Avenue Radio.world. Rainier Avenue Radio.world. We got you covered. Local impact, global presence.
We broadcast welcome to Rainier Avenue Radio.world and our weekly coverage of the impact.
our series. I'd like to thank everyone for joining us again here. And then again, now we are aware of the fact that we are and more folks listening that
You know you can't get enough of Rainier Avenue Radio. .world.
Welcome or welcome back to Rainier Avenue Radio .world. It is me, Tony B., your host of the impacts of the coronavirus on South Seattle and surrounding communities. Again, we've been doing this since March 13th of 2020. In no way did I think that we would be here 14 months later, still having these and needing to continue to have these conversations. At this point, I can't tell you if we'll ever stop doing this special programming because of the impact that the coronavirus is having on everything. We just had a conversation where we were discussing immunizations and the fact that with John Dunn, the medical director for Preventive Care at Kaiser, but also representing the Washington chapter of the American Academy of Pediatrics, about the fact that there's been a decline in vaccines and immunizations in lots of areas. And of course, there was a disparity again in BIPOC communities and white communities in a number of different vaccinations. And then we get this message that vaccinated people no longer need to wear a mask or physically distance in any setting, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. And it seemed as though not everybody was on the same page with this announcement, which was pretty major and pretty significant. To say the least, it's been confusing. Even the fact that fully vaccinated people should refrain from testing following a known exposure, unless they are residents or employees of a correctional or detention facility or a homeless shelter. All of this is just incredibly confusing. And I will say, thank goodness we have Jeffrey Duchin, who's always steps up to the plate, even if he's just finished the press conference, to come on and inform our communities and try and alleviate any misinformation or share information. And he always has open, frank, honest conversation with us so that we can make decisions, educated decisions about what we choose to do with our health. So I want to bring Dr. Duchin on right now. Jeffrey, how are you?
Tony B., it's so great to be back with you. Thank you for being flexible with my schedule today. And I always look forward to being on Rainier Avenue Radio.
Well, thank you. And I mean, I think you know where I'm at. If you heard a little bit of my opening there, and even in speaking with prior to when you were on, I was talking with a gentleman, and they were talking about the street fair that's going to take place, Employment Street Fair, where folks can come physically, and he was talking about the hesitancy that folks were having about, well, still, should I do this? And then you think about it, it was just a couple of weeks ago where we were waiting for an announcement that might even roll us back to some potential places that we hadn't gotten away from. And it's just all really confusing. So my first question to you before we even get started about this is, did you find out about this the same way that we did? That these guidelines was this something where folks were contacted? Did everybody know what was going to happen? Was this discussed, agreed upon?
Okay. So this was a big surprise to everyone, even people within the government at the CDC and even the president. I mean, I can tell you this has been the most uncoordinated and counterproductive messaging from CDC that has ever happened. And I love CDC. I used to work there. I have a great respect for that agency, but they boffed it big here. They made just a rookie error, a new director, and this was uncoordinated. That they didn't do the type of planning they need to communicate this type of new, significantly new guidance, and so it caused incredible frustration, unnecessary confusion, both in the public and among policymakers, public health people, and government officials up and down the spectrum. So we want to try and fix that because there's a lot of good in that CDC guidance that was overshadowed by the bad communication strategy.
And so for folks, who became engaged with the existence of the CDC as the pandemic outbreak started, and we were told, trust the science, follow the science. At the same time, we were getting political messages that, the CDC isn't getting this right, And then we got into masking. And from my understanding, there were some added benefits to the masking, is that we saw fewer cases of influenza. Now, we also know that this impacted our mental health, along with our, the physical ailments that this contagion caused. So again, the information that we're getting from the CDC, whether it was timely, whether it was communicated well or not, accurate? I mean, now again, saying this, the CDC has no law enforcement capabilities. They can't say, to make it happen to small business. This is up to local governments and tribal governments and businesses. But is this trustworthy information? Is this accurate information? Is this really where we are potentially at? Taking your masks off, outside, inside, if you're vaccinated?
Okay. Here's the scoop from my perspective. CDC the science is very trustworthy, and I'll talk about that in a second. But we use that science to inform policy, and that's where they kind of messed up a little bit in not recognizing that, right now the country's, not everybody's in the same place, and that this science can inform policy. But the policy that you make based on the science will differ depending on what's happening in your community and the values of your community. So, for example, it is absolutely 100% correct that these vaccines work incredibly well, and vaccinated people have a very high level of protection against COVID compared to unvaccinated people. And they have a much lower chance of getting sick or spreading COVID to anybody else. There's no debate about that. They were right on. If you've been vaccinated, you're at very little risk of getting COVID. You can take your mask off and feel that you're not at high risk, and you can take your mask off and feel that you're not going to spread it to somebody else. However, the policy piece is that the implications of having vaccinated people take their masks off right now, when we still have substantial to high levels of COVID spreading. In other words, in King County, overall, we've got the second highest rate of COVID spread according to the CDC's ranking, which is substantial. But some of our communities are still at high and some are at substantial. It may be small pockets or at lower levels. But what it means is you still have a very good chance of bumping into somebody with COVID-19 in our community right now. So if we tell people who are vaccinated, you no longer need to wear a mask indoors in public spaces like grocery and other stores. And the only people that should mask are the unvaccinated people, because they're the ones at highest risk of getting COVID and spreading it to other unvaccinated people, or to people who have weakened immune systems and didn't respond to the vaccine, or to children who can't yet get vaccinated. If we say only you unvaccinated people need to wear a mask, what that means to me is the policy fails, because I think it's very unlikely that many unvaccinated people, or most of them, will wear a mask for a couple of reasons. One is because it's kind of stigmatizing. Why would an unvaccinated person want to put a mask on and announce to everybody else that they're unvaccinated when everybody else doesn't have to wear a mask? And we've also seen on social media lots of unvaccinated people saying right away, I'm taking my mask off and nobody knows I'm unvaccinated. I'm just circulating around. So I think, the fact is, when you tell people that only part of the population has to wear a mask, it's not a practical solution to our problem, which is we have COVID circulating and we need to prevent it. It requires, there's no practical way to know who's vaccinated and who's not. So a business can't check this. You just depend on people on the honor system. Now, we have a lot of COVID still, and what that would mean is there are unvaccinated people indoors at close contact with other unvaccinated people, with young kids, with people who are vulnerable because they have underlying illness, and with other people who would like to get vaccinated but haven't gotten vaccinated yet, so they're still susceptible. And there would be an increased risk of COVID transmission. We have good vaccination rates in King County. About 70% of people plus have had one dose, and about a little over 50% have had 2 doses. But most of those people are older adults. So when we look down at the younger ages, we have much lower vaccination coverage, for the ranging, from the 20% up to the 30 to 40 to 50, depending if you go from age 12 to 50 years. So much more people still need to be vaccinated in the younger ages. And a lot of those people are those frontline workers that are still vulnerable. In addition, our Black and Hispanic communities in particular have not been vaccinated to the degree that the white people have. So the completion rates of vaccination in the Black and Hispanic communities are in the mid to high 30% range compared to 50-something in the white community. So there's a lot of vulnerable people out there who would be exposed to COVID if we went with the policy of only unvaccinated need to mask. And what I would like to do is get our disease rates down so you're less likely to bump into somebody with COVID in the first place, and get more people vaccinated. So if you do bump into somebody with COVID, you're protected before we get rid of this mask mandate. So we're planning to continue it until we get 70% of the population fully vaccinated. And that should be another 4 to 6 weeks, and give people now they're on notice. And 6 weeks from now, it's quite likely that unvaccinated people are going to be in your face, and they're not going to be wearing a mask anymore if you go into a public space. So if you want to get protected, get vaccinated.
Now, you mentioned you were going to say something about the science. Otherwise, I'm going to dive into another question and let you finish.
Yeah. Well, the science is that the vaccine, they were absolutely right about the way the vaccines work. The reason they came out with their announcement was because they wanted to assure people how well the vaccines work, that people can get back to their normal lives if they're vaccinated safely. The only issue is, before you tell everybody they can take their mask off, you need to get more people vaccinated so that the community as a whole is safer, and you need to get your disease rates down.
Okay. So if a few days ago, might have been a week ago, might have been a week and a half ago, we hear about a bunch of Yankee professional baseball players who were vaccinated but were COVID positive. But there's this message that says fully vaccinated people should refrain from testing after it's been drilled into us. If you think you've had any type of exposure, get a test, get a test, get a test.
Mm-hmm.
Now the message is refrain from testing following even a known exposure.
Mm-hmm.
So from our King County health officer,
I'm glad you're asking me easy questions today.
What is it? What is that's just confusing.
Yeah. Here's the scoop with that. So it's not telling people not to get tested, but saying you don't have to be tested routinely in these settings if you've been vaccinated, because your risk of getting COVID is really low, and your risk of getting a serious case of COVID or transmitting it to somebody else is really low. So if you do get it, it's probably going to be an inconsequential infection. Here's what happened with the Yankees. And and in some high-risk settings, like congregate settings, where homeless live, in jails or prisons or in long-term care facilities. Those settings, we do recommend testing currently in King County, even though it's optional formally in the federal guidance. But with the Yankees, here's the scoop. They had a travel squad. and this is the best I understand, it's kind of not firsthand information, but from across the country. They had a travel squad. This travel squad was vaccinated, and my understanding is they got the J&J vaccine, which, as you know, is about 70% protective against any infection, and much higher, 85 plus, against severe infection. And their travel squad, had a lot of close interactions. We would consider high-risk interactions with lots of people over multiple trips, not taking the usual precautions because they were vaccinated. And one person on that travel squad developed an illness. And the travel squad, I don't really know the exact number, it might have been around 50 or so, but one person developed an illness, and then they were tested and found to have COVID. It was not a serious illness, but it was COVID. They then tested the squad, and they found, I believe, 7 others who tested positive, but these people were not ill. So they had either very mild or no symptoms at all. And so basically, the vaccine worked very well in that out of that large travel squad, first of all, the number of people that you would expect to become infected based on a 75% protection level was about right. And the number that did get infected got mild diseases. So it protected completely against severe illness. Nobody was hospitalized, et cetera. So the story sort of made it out to seem like it's a vaccine failure. But if you look at the math of it, if you've got a vaccine that's 75% effective, based on the exposure, that risk that they thought these people had, about the same number of people, became infected as you would expect. The vast majority of the travel squad did not become infected. The ones that did got mild illness, or actually maybe one got mild illness. The rest were asymptomatic, is my understanding. So it does show you that vaccines are not 100% protective. That's really important to know. And that's another reason we want to keep our mask mandate, because we want to avoid as many infections as possible. We understand that not everybody is going to be protected. And if you do get infection, you're much less likely to get a severe infection or one that will land you in the hospital. And you're much less likely to spread it to others. So that's kind of the scoop with the Yankees. And it does line up with what we know about the vaccines, and it doesn't in any way, based on the information that I have, it doesn't in any way suggest the vaccines did not work as expected.
Okay. And again, I don't know whether it's a curveball, a changeup, or a high heat right under your chin. But again, you can take the mask according to the CDC, in outdoors, indoors. However, transportation, if you're taking public transportation, whether that be the light rail or the bus service or a train or a plane in domestic travel, wear your mask. Can you explain to us if on the one hand we can be indoors, of course outdoors, but in public transportation, masks are still required? Why is that?
Yeah, there's a couple of places where masks are still required for everyone. Correctional facilities, homeless shelters, schools, public transportation, certain healthcare settings like doctors' offices, long-term care facilities, hospitals. The reason for that, and I would not be surprised actually if you see some new guidance coming out eventually, again, I think is that the CDC is recognizing that not everybody is vaccinated yet. And that in public transportation, unlike going to a store, you don't always have a choice, and that for some forms of transportation, in particular, air travel or train travel, it's very prolonged, much longer than it would be in a shopping situation, and so there's a slightly higher risk there. So I think they're trying to be more conservative in that setting. I do imagine that when you have a certain level of vaccination coverage, that that guidance will change also. But at this point, and I think it's very appropriate. I mean, I think they should continue to require the mask in many settings until you have a certain number of people vaccinated and your disease rates are low enough. But it's really trying to be cautious and recognize the fact that many people who take public transportation still are unvaccinated. Many are not eligible for vaccine, and also that most places still don't have high enough vaccination rates to make a policy of voluntary masking useful. I think it would be just like in other retail here in King County, where we think voluntary masking wouldn't work and would lead to increased transmission. The CDC believes that's true for public transit across the country.
All right. And so here in the state of Washington, where are we at? What can we do? What can we not do? And the other part of that question is, how much do folks like you who bring the science into this impact the policy that we're under right now, and that we may be, as we, I don't know what to call it, transition, from this other place back into this new thing, so that we can feel confident about what we should not do here in the state of Washington as compared to what we hear about on a national level.
Mm-hmm. So, I have influence on King County policy.
Mm-hmm.
And I know that our county executive confers with the governor and provides input to the governor, but the governor makes the decisions about, what's permissible to do on the state level according to his Healthy Washington Roadmap to Recovery. For example, based on the numbers that we had a couple of weeks ago, we would have been put back into phase 2. We're currently in phase 3, but the governor, sort of gave us that pause period to see what would happen. And we were heavily involved in that. He asked me to join him at his press conference, where I thought that it was a good move not to put us back in phase 2, because I thought we had a good chance we would turn the corner, and we did. We're now below the cutoff for phase 2, and our numbers are dropping nicely. Even though they're still elevated, we're heading in the right direction. So we remain in phase 3, and there's some pretty clear guidance. If people just want to Google Healthy Washington Roadmap to Recovery, you can see what's permitted in all the phases. Mm-hmm. And the governor's got guidance for all sorts of different activities. But the place we're really headed at the end of June is what the governor says is going to be back to reopening Washington up, to no more restrictions on activities. And this has me worried, I have to say, quite frankly. I mean, this is why I really want people to get vaccinated now, because if we all go back to doing what we were doing, and face mask wearing will be optional, it won't be required, and it's perfectly fine. We might want to talk about this a little, but for people who are still concerned to wear masks, I mean, that should not be stigmatized. You should be allowed to, if you want to reduce your risk, or you're still vulnerable because you've got an underlying condition, or you just don't feel safe. I mean, mask wearing should not be, ridiculed, and particularly, as you said, Tony, it protects against influenza as well. And this fall, I would not be surprised to see a rebound in COVID in our community. But I hope it's not a big one. And the more people are vaccinated, the less risk of that we'll have. Now, I don't know if you want me to get into the details of, how many people can do what now on the roadmap, or just kind of look at that on your, I can easily send you the link, or I know it's easy to find on the web. What's your preference?
Well, we're about out of time here. Okay. And so I'm going to give you the opportunity for final words here, because again, we've got folks who are fully vaccinated. We've got folks who are immunocompromised. We've got 12 to 15-year-olds potentially getting vaccinated, summer camps potentially starting again, school next year, and some folks who just say, I don't trust any of this. I don't want to take off my mask. And again, then we have the social stigmas that may be potentially attached to all of this. And again, you say, which is why I asked you, how much influence do you have, or folks like you, on driving the actual policy? And then now we might be opening up again. So I'm just going to give you the room for final words here. You'll have a couple minutes, Jeff.
Okay.
To share your thoughts with us.
Thank you, Tony. And again, it's just great to be back with you. I'm glad it worked out. So I did issue a health directive yesterday that folks can find on our Public Health Insider website. It has a Q&A. Strongly recommending to all King County residents and businesses to continue with the face mask policy that was working so well for us for over a year, meaning everybody in an indoor public space should continue to wear a face mask. And some people may be asking themselves, well, if I'm vaccinated and the vaccines work so well, which we agree with, why should I still wear a mask? And it's basically because in stores and other public spaces, if we say only vaccinated people, only unvaccinated people need to wear a mask, we have no way to know who's vaccinated and who isn't. And businesses can't determine that. So the risk for COVID spread will increase when people who are unvaccinated don't wear masks. So the best way from a community health perspective to take care of one another, and the most reliable way to ensure that we're all safe, is to wear that face mask indoors for a few more weeks and to get vaccinated now. The more people that are vaccinated now, the better protected we'll be in the short term and in the long term. So that is clearly, the most important thing. But just know this, that, in a couple of weeks, we will not be requiring people to wear masks. It will be voluntary. And the most important thing then you can do to protect yourself going forward, because there will be lots of people out there who may not be vaccinated and won't be wearing masks, will be close contact in public spaces. To protect yourself is to get vaccinated. And remember that COVID is airborne. It spreads through the air. It floats around like cigarette smoke or perfume. So anything that you can do in workplaces or homes or other environments to increase ventilation, opening windows, doors. We have great guidance called Improving Air Quality on our website to help people understand how they can reduce the risk by increasing that airflow will pay off in the long term, both with COVID as well as other respiratory diseases that travel through the air. But bottom line is, like everything else we've done to be one of the most successful counties in the U.S. during the COVID-19 pandemic, working together for the individual and the common good is the best way to protect all of us. And there are communities, particularly in South King County, Southeast King County, that have very high rates of disease and very low rates of vaccination now. And if you've got suggestions for us on how we can help people get vaccinated in your community, if you don't feel like you've got access or you have questions or others do that we can help answer to help people make a good decision for their health, get in touch with us, and we want to help.
Dr. Duchin, thank you again for taking the time. I know you did the thing yesterday, but again, maybe, folks, everybody doesn't have time to check a press conference. And this is ultimately really important to our community because there's just, there's a lot of confusion out there. And just wanted to, I know you bring it when you come on the show, and I wanted folks to get an opportunity to hear your thoughts and then make a decision from there. So thank you once again for coming on and on such short notice and sharing this information with our communities.
I love to join you. Thank you so much. It's good to see you.
All right. Make sure and join us a little bit later. You won't be able to attend in person, but we do broadcast high school sports, and we've got another coming later tonight. We've got Rainier Beach taking on Franklin. The girls play at 5:45. The boys play at 7:30. We'll be bringing you both of those games so that you can watch the storied rivalry right here on Rainier Avenue Radio.world. It's me, Tony B. Again, on behalf of the staff, this has been another broadcast of our impacts of the coronavirus on South Seattle and surrounding communities. Hopefully, we'll see you a bit later for basketball, and we'll take you to our regularly scheduled programming. Right now, that's it. That's all the time I have. That's going to do it for the kid. It's me, Tony B, saying, remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace.